Hello everyone, my name is Leah and today I will be discussing therapeutic ultrasound, applications, and safety. Ultrasound is an excellent medical imaging technique that does not contain any harmful radiation, does not require any downtime, and is minimally invasive. Therapeutic ultrasound is a subtype within the ultrasonic modality that utilizes heat delivery to soft tissues to promote healing and decrease pain. Today we will be discussing three main topics: physics, applications, and safety. Then we will go over a few quick questions and conclude. First up, let's talk about the physics of ultrasound. Ultrasound refers to mechanical vibrations at a high-frequency sound above the audible sound range, of which the upper limit is 20 kilohertz. For reference, humans can hear sounds between 20 hertz and 20 kilohertz at the upper level. When we discuss ultrasound, there are a few key definitions to remember. Some are a little more complex than others. Sound is a series of pressure waves propagating through a medium. This sound travels as a mechanical longitudinal wave in which particle motion is parallel to the direction of wave travel. One cycle of the acoustic wave is composed of a complete positive and negative pressure change. The wavelength is the distance traveled during one cycle. The frequency of the wave is measured in cycles per second, or hertz. Velocity is the speed at which a sound wave travels through a medium and is also called propagation speed. It is measured in meters per second. The transducer is a device that produces sound waves that bounce off the body tissues and create echoes. The inverse piezoelectric effect is used in the production of ultrasonic sound waves. Materials usually are about quartz, barium titanate, and lead zirconate titanate, or PZT. Application of high-frequency alternating current to the PZT crystal of the transducer transforms the electrical energy into vibratory sound waves. Now that we've covered the basics of the physics, let's go over how wave transmission works. Through compression and separation of the molecules using the transducer, wave transmission can be acquired in solids, liquids, and gases. These waves are typically cylindrical and longitudinal. The velocity of the wave is higher in materials of high density and lower in materials of low density. The most important known velocities include the following approximations: 330 meters per second in air, 1480 meters per second in water, 1580 meters per second in muscle, 4080 meters per second in bone. It is also important to understand that there are different properties of the ultrasonic beam. As you can see from this helpful graphic, we have 5 main types: reflection, refraction, dispersion, absorption or attenuation, and divergence. Therapeutic ultrasound utilizes absorption most often. Now that you're an expert in ultrasound physics, let's move on to the applications of ultrasound therapy. Therapeutic ultrasound is the application of frequency sound waves to tissues in order to promote healing and reduce pain and swelling. Typically, 1 to 3 megahertz results in the deep heating required, and the depth of penetration is inversely proportional to the frequency utilized. There are many therapeutic benefits to utilizing ultrasound in this way. Among them are treating chronic pain by increasing membrane permeability, promoting healing in the soft tissues by stimulation, breaking up scar tissue by increasing flexibility with heat, and encouraging edema dispersion by mechanical massage. Examples of physiopathology that benefit from this therapy include carpal tunnel syndrome and frozen shoulder syndrome. I actually have a very personal experience with therapeutic ultrasound that I would like to share. In April of 2021, I had to have an arthroscopic thermal tightening surgery of the scapholunate ligament and a reattachment repair and stabilization of the TFCC ligament. Part of my recovery was physical therapy for 12 weeks. It definitely felt a lot longer. Twice a week, after pushing my limits in regaining mobility, the physical therapist utilized therapeutic ultrasound for approximately 10 minutes to break up scar tissue, promote healing, and relieve my pain. Here are a few images to give you an idea of the results. The first picture is when I had just had my cast removed. The second is after a few weeks of physical therapy and therapeutic ultrasound. And week 12 shows excellent scar healing and less swelling. I now have full mobility of my wrist again, as you can see. And I definitely attribute some of my healing to therapeutic ultrasound. I know I am not the only person to have benefited from therapeutic ultrasound. The treatment itself is very common, with millions of therapy sessions being performed each year. From musculoskeletal to neurological, from soft tissue injuries to chronic arthritis, therapeutic ultrasound applications abound. Right, now we will briefly discuss the history of ultrasound therapy, then patient safety and therapist safety. Therapeutic applications of ultrasound actually predate its use in imaging, and it was used for many years before it was considered an imaging modality. It is typically considered to be a very safe treatment tool due to its minimally invasive nature. That being said, there are a few major safety concerns we should be aware of, and contraindications do exist. Avoiding abnormal vascularity in ischemic tissues is imperative, as the heat dispersion is not even and heat has nowhere to go, so it could do more harm than good. Cancerous tumors are another contraindication, as some research indicates that ultrasonic therapy on tumorous areas may encourage the tumor growth. In some cases, even pregnancy can keep a patient from engaging in therapeutic ultrasound, especially therapies anywhere near the uterus. Another important safety point regards the therapists or physicians using the machine. There are two different topics here: work-related musculoskeletal disorders, or WRMDs, and proper machine safety etiquette to maintain a safe environment for your patients. WMRDs occur gradually over time due to repetitive use. The most common injuries seen in ultrasound therapists are in their wrists or elbows. It is important to practice proper ergonomics and to avoid poor habits that eventually result in painful, long-lasting injuries. It is also important to keep the transducer parallel with the patient's skin to exclude any air balance irregularities. Engage in continuous movement to avoid hot spots. Utilize a pattern of overlapping circles, and utilize proper depth and pressure. Ultimately, it is the responsibility of the therapist to ensure your patient is not uncomfortable or in pain. Now that we've gone over physics, applications, and safety, let's ask a few questions. First, what are the thermal and non-thermal effects of ultrasound? Well, thermal effects include increased collagen extensibility, increased blood flow, less pain, reduced muscle spasms, decreased joint stiffness, and less chronic inflammation. The non-thermal effects include increased fibroblastic activity, increased protein synthesis, encouraged tissue regeneration, swelling reduction, bone healing, and decreased pain. Secondly, what are the different pulse types and why are they important? Well, there are two types, pulsed and continuous. They describe exactly what they do. Pulsed mode has breaks in between the sound, and continuous mode is constantly producing sound. Pulsed mode gives us mostly non-thermal effects. It reduces inflammation and increases collagen. On the other hand, continuous mode generates thermal effects with deep heating by stimulation of the tissue. Both types have benefits and can result in pain reduction. The key takeaway to remember here is that applications and safety are extremely important topics when discussing therapeutic ultrasound. This therapy is versatile and widely available, and it's a great way to support better outcomes for your patients. Also, while ultrasonic therapy is considered to be quite safe, there are several important safety considerations we must pay attention to in order to keep our patients and therapists safe. In conclusion, therapeutic ultrasound is a highly effective tool that offers transformational opportunities for healing. I even have firsthand experience. Thanks for learning about this topic with me today.